Welcome to a conversation with a community leader sponsored by Leadership Kitsap. I'm your host, Cary Bozeman, and I'm the former mayor of the city of Bremerton, and I'm currently a Port of Bremerton commissioner. And my guest today is certainly a community leader. It's Jay Burghart, the CEO of the Doctors Clinic. Welcome, Jay. Thanks for being with me today.
Thank you.
Yeah. Before we start talking about medicine and all the things that are going on in the world around that issue, where are you from, Jay, and what brought you to Kitsap County?
So I was born and raised in central Minnesota, spent a good share of my life right there, moved to the south in my teenage years in Arkansas. And my parents moved into Washington as I was in college down in Texas. And as my family members all visited Washington, we've all been drawn here over time and now all live in the state of Washington.
Wow. What did your father and mother do?
So my father was basically a plant services person for college systems, and he took a job over in Walla Walla, taking care of the physical plant of that college, and my mom was pretty much a stay-at-home mom most of her life, and odd jobs here and there. Besides,
did you spend time growing up in Walla Walla?
I did not. They moved to Walla Walla as I was in college down in Texas.
Well, Walla Walla is one of my favorite little towns. One of the best wine producers in the world. And my wife and I have fun visiting there all the time. And there's a couple of really good colleges there. So
there is.
Jay, what is the Doctors Clinic?
So the Doctors Clinic is a group of physicians, multi-specialty in nature. The heritage of the Doctors Clinic goes back to the 1940s in Bremerton, where several physicians of multiple disciplines came together to become what was originally called the Jackson Clinic, and then became the Doctors Clinic in the 1940s. And we have been a group of physicians owned and operated by physicians in Kitsap County since the 1940s.
Are you a nonprofit organization?
No, we are a for-profit corporation, a professional service corporation is what it's called. And basically we're in the business of making enough income to pay physicians fair market wages.
Uh-huh. How many people are in the Doctors Clinic? How big are you?
So we're about 80 providers, 60 physicians, and 20 other types of providers, physical therapy, PAs, nurse practitioners, audiologists, people like that. And we are supported by a staff of roughly 350 non-professional or non-physician type support staff.
You have a board of directors that you answer to?
We do. A board of directors, all part of the physician ownership group. A board of directors of 6 physicians, a president, and a medical director.
Are there other similar kinds of organizations around the country, like the Doctors Clinic?
Yes, many organizations like us. We are what we would call sister organizations to groups that may be familiar to you, like Polyclinic or the Everett Clinic. There's less and less physician practices over time because they're becoming part of more consolidated healthcare structures, as are we in a way here in Kitsap.
What's your relationship with CHI Franciscan / now, I guess, Virginia Mason?
So we are we have a contractual agreement with them, and so the Doctors Clinic is now what we would brand as the Doctors Clinic, a part of Franciscan Medical Group. We are still owned and operated by our physicians, and our physicians employ staff like myself to run the entity called the Doctors Clinic. But we are contractually aligned with Franciscan Medical Group in terms of how the economics of our practice works today.
And explain to me how this new relationship they have with Virginia Mason. How does that work?
So Virginia Mason and Franciscan Health came together to be a single entity. And so basically the brand name Virginia Mason Franciscan Health is a combination of all the entities that used to be Virginia Mason and all the entities that used to be Franciscan Health, and they are run as a single company now.
Oh, that's really interesting.
Yes.
So the days of independent little hospitals like we used to have here, what we call Harrison, those are over, right? And why is that?
So primarily because of the economy of scale. It's, like any other industry, you need to be able to operate with less and less cost and overhead structure, whether it's your practice like the doctor's clinic, or whether it's an entity like Harrison Hospital was, that there are so many infrastructures that have to be in place to run a hospital that you can basically do it more efficiently if you have, say, a director of quality for 7 hospitals is just more efficient than a director of quality for each of those hospitals, as an example. So the other primary reason is because of contractual scenarios. If you have Boeing that wants to contract with an organization directly, you need to have a breadth and width of an organization, whether it's in Seattle or Tacoma or Bremerton, in order to attract and do business on that type of scale.
Well, what's going to happen to all these rural hospitals out there that have been providing service to these smaller communities are they going to all go out of business?
Well, I think, some of them become smaller over time and less services get rendered there. Some of them become part of larger organizations, and some of them go into different structures that the subsidy or cost revenue mechanisms for a small hospital, what they call rural hospitals, basically get paid differently. And I think more over time, more of the smaller hospitals are going to be structured that way, so that you can have a small hospital.
Well, in a lot of cases, like I've got friends that live in Aberdeen, Hoquiam, Grays Harbor area, and their little hospital was having a lot of problems financially a few years ago. So they went to a public hospital, a tax supported hospital. Is that what has to happen by and large?
Yes, a tax supported situation. And usually if it's small enough, there are different mechanisms to get paid that are based more on your cost and less on your revenue. And so, there are small hospitals that may be an emergency room and 10 beds in a tiny town somewhere. They'll never make it on the revenue that they generate. And so the mechanisms that are in place to fund those are based on how much is your cost. And so there's a specific amount of cost that is provided to that small rural hospital, along with the tax base that helps support that hospital. And then it can provide service to patients, regardless of the ability to make ends meet revenue and expense wise.
Yeah, it's unfortunate. Hey, skipping over to another subject, how has COVID impacted your organization in the last 15, 18 months?
Well, pretty significantly in many ways. First of all, we became, our urgent care in Silverdale became really, I would say, the #1 place in Kitsap County where patients came that were symptomatic and that patients needed to be tested. We have by far the highest number. I think the last time I looked at it, we've tested about 25,000 people in our urgent care, which is run by primarily 5 providers and a small staff of 10 or 12 medical assistants and nurses. And they've done.
Do you have testing sites though in other locations besides the hospital?
So our urgent care, which is in one of our locations, has tested 25,000 people.
Oh, your own urgent care. Oh, I
Our
got
very
it.
own urgent care, right next to the PetSmart here in Silverdale.
Yeah, I got
Yes.
tested there.
Yes, that's the doctor's clinic.
Oh, okay.
Yep.
So how's that operated? How's it working?
So when COVID hit, obviously we had to go from taking care of ill patients that in various ways, basically less patients started coming to us. More people started staying at home, which isn't all good for people that might have heart disease or some other thing. And we became much more of a triage site for taking care of symptomatic patients or exposed patients and testing people. And we had to set up tents outside of our facility there so that we could safely triage people out of the rain. And yet, if you bring people inside, you expose patients and staff significantly more. So we really restructured how we took care of those walk-in patients. For example, in 2 years ago, if you came to urgent care, you walked in the front door, registered at the front desk, and we saw you as quickly as we can. Now you walk in and you get registered and you go sit in your car and wait for your phone to buzz.
Yeah.
And we bring you right in the back door and test you and get you right back out with minimal contact to anyone.
Yeah.
So lots of changes there.
Yeah. Do you think, Jay, that your organization or any of our medical organizations gave this a pandemic idea much thought before it hit us all?
Not really. Yeah, not really. I would say, every once in a while, as an organization, you would have what I would call a little fire drill, where a patient would walk into a facility that you were worried had the mumps or measles or some other highly contagious disease, and you went into shutdown mode and lockdown and sterilized everything and made sure no one was exposed. And you got through that particular event, and then you went back around your business. And so really, those are the types of events that we have dealt with historically. And we've kind of started to ramp up several times in different situations as Ebola scare happened and the swine flu, what we call the swine flu, different types of things happened where we started to build the health system to be prepared. But most situations like that very quickly diminished, and so we never went into full-scale pandemic types of situations.
Well, do you think we've learned something from all this and we'll be better prepared next time?
I hope we can be. We need to have a different viewpoint about how these things develop. I think if we could have been 60 days further ahead of knowing what was coming, because I think in hindsight we could have known at least 30 or 45 days earlier. If the alarm bells would have sounded a little differently, I think lives could have been saved.
Well, I remember watching I think Bill Gates did a TED Talk 5 years ago and talked about, look out, pandemic's the big potential wolf in the woods out there, and nobody paid much attention to him at the time, which is unfortunate.
It was, and like many other things that we've talked many times in the past about, you have to see a little further down the road than who needs dollars immediately today, and you have to have a little longer vision of where dollars ought to be spent to have the most value.
Now, what's your assessment, and how did you guys, the doctor's clinic, involve yourself in administering the vaccine?
So we haven't administered vaccine yet.
Oh.
So right now, most of the vaccines in this county are, up till now, there's two what I call super sites that have been administering a lot. The Harrison Hospital here in Silverdale has administered a lot. And then the Kitsap County Public Health Department and volunteers in the old St. Michael's facility has done a lot as well. And so now we're really morphing into the next stage of vaccinating patients where there's more availability of the vaccine. And we are now starting to build infrastructure within our primary care physician practices to administer vaccine, primarily because the patients who haven't had it yet are people that are a little reticent to do it and need to consult with their doctor prior to getting the vaccine. And so up until now, it's been more about how do we do it the fastest. And that's in big sites with lots of volume and just so we can efficiently administer what we have.
And from what I understand, all these health departments across the state, they all kind of operated differently on this issue. There was really no role model, so to speak, and each health district kind of had to try to figure it out themselves. Some did better than others, obviously. How would you grade Kitsap County and our ability to get shots in arms here? Are we been better than average, or?
There's two things that really affect, shots in arms, and that's the ability to get it to where the patients want it and getting the word out about patients and developing patients wanting to get it, which has really been our dynamic here for at least the last 30 days already, is that we have more availability than we have people who want it in their arm. Yep.
Let me ask you about the mask issue. There's a lot of controversy going on now about the mask, and the CDC saying if you've been vaccinated, you don't have to wear a mask even inside. What position are you guys taking at the doctor's clinic?
So, well, quite honestly, we haven't taken a position yet. It's very new information, and the state has basically published that they're going to go down the path of taking the CDC's advice, but they haven't really written the regulations on what they're going to do yet, at least to my knowledge. And they've kind of announced what they're going to do, but when you actually go out to their publications, it says, in process, more information to come. And so for us, first of all of the demasking that the CDC has recommended doesn't impact healthcare, right? So the recommendation is if you're taking care of patients in a healthcare environment, patients should be masked. Staff should be masked, and so most of our employees, are still operating under the scenario of coming to work and wearing a mask, and patients need to be masked, which I think makes a lot of good sense at this point because they're taking care of symptomatic patients in various ways.
Yeah, I do too. My wife and I certainly keep our mask with us wherever we go, and out of respect for not only worried about ourselves, but out of respect to others. So I think the mask thing is going to be around for a while.
It is. I think it's going to fade away slowly.
Okay, let me ask you, I've got so many questions that we're already going to run out of time, but for years, if you had a serious health issue, you had cancer or something serious that you needed treatment for, a lot of people would go to Seattle to, Swedish or Virginia Mason or University Hospital or those kind of things, because there was a sense that you could get better care than you can here. Where are we now with that idea? How good a healthcare can we find right here in our own community?
We have a lot of really good healthcare here in Kitsap County, and I would say that. Is there areas where you should go to Seattle for certain types of care? Yes, absolutely. Because particularly in very subspecialized healthcare, there's not enough volume of certain types of things that happen for someone to be the expert or be super proficient at that particular surgery or a certain rare cancer or some situation like that. And so there are many situations where it makes complete sense to go to a higher level of care. But there's also many physicians that with significant talent that want to live here in Kitsap County and in my opinion, provide state-of-the-art capabilities in many different venues in our healthcare system right here in Kitsap County.
Jay, I go to, there's the doctor's clinic, and now there's all these big organizations. Where are we with independent doctors? Are they kind of, is that kind of a thing of the past, where they're not members of large groups?
So very quickly, not have the event of having a large group that's completely independent is becoming less and less and less. However, there are pockets of independent practices that do quite well, either because that's just the way they want to practice, independent of the economics. And there are certain types of specialties that still do quite well on their own. Dermatology would be an example that comes to my mind, where the economics of practicing dermatology works quite nicely in independent practice. And we have many independent dermatologists here in Kitsap County that do great work. And then there are other types of specialties that really would struggle economically to not be a part of a larger healthcare system. And so it really depends on the specialty, and it depends on how necessary it is for a physician to make market competitive income to stay. So yeah, because that's highly important to get talent here.
Yeah, and so another interesting thing that's popped up over here, and maybe at other places, there's a service started here in Bremerton, actually in near my home, Manette, where you can pay a monthly fee and go in and get, I think the people running it have been nurses in their career. Not sure they're doctors, but I don't know that. So they pay a monthly fee, and they can come in and kind of get kind of a general, if they're not feeling well, you know what I'm talking about.
Yes, it's a term called direct primary care.
Yeah.
And so there's kind of two basic models of that. One is where you pay a monthly fee, and you can get all the service that primary care provider can provide for that monthly fee, and the insurance isn't billed at all, right? And they don't deal with insurance, and that's how they can keep their costs down as well and provide that care. And it's a little more one-on-one. And then there are direct primary care practices that bill your insurance, and you're just kind of paying a premium for maybe premium capable services, more direct access, call your physician and have more phone cares, call them on the nights or weekends, and have it's a little less people per doctor type of boutique medicine, and people like that and find it valuable. So
my guess is a lot of your patients are older, so I'm assuming they're on Medicare. Many of your patients.
Correct.
And then there are people who have secondary insurance, and there are people who have no insurance. I had a friend who unfortunately had to go to the emergency room at Harrison, not Harrison anymore, but CHI, a couple of weeks ago. And the bill they got, and they had insurance, but they were there 30 minutes. The bill was $2,000 to go to the emergency room.
Yep.
Now, I know a lot of people go to the emergency room who have no insurance, right?
Correct.
So is there an answer to this escalating cost of medical care, or is there nothing we can do about it?
I do think there are answers to the escalating costs. Some of it's liability, right? And that without any protection from liability, when you walk into that emergency room, that physician needs to do a bunch of tests on you in order to make sure that that they aren't missing something, because you're in an emergency room after all, right? And when in fact that patient very well probably should have come to our urgent care instead of going to the emergency room based on their diagnosis. In a more efficient scenario, it'd be nice to say, to be triaged and say, well, you really don't need to be in an emergency room, go down the street to the urgent care. But if something significant happens, what's the liability of missing that particular event. So malpractice and liability around good medicine is one of those concerns.
Yeah, I remember talking, this is 30 years ago to, just 20 years ago, to my position that I had at that time. And he said, Cary, malpractice insurance is almost driving me out of medicine, so yeah. Hey, Seattle is experiencing, and has been, and other communities, this huge homeless issue. And some of that's driven by mental illness. What's your assessment of our ability to deal with mental illness issues in this community?
It's difficult. It's really difficult. It's probably one of the primary things I hear from our primary care providers out there is to have enough people in our system to take care of the mental health issues, both covered and not covered. It's just it is an escalating problem that we are just underserved in so many ways, whether we talk about funding or whether we actually talk about the providers who do the work. There's just not enough of it to take care of the current need.
I agree. The other one where I think we fail, maybe not as much, but it's in preventative medicine. In other words, educating people about how to stay healthy. And I did a study. I was involved with the Boys and Girls Club of America for about 25 years. And what we found was we had so many obese young kids. And a lot of them came from low-income communities. And, they just had health problems the rest of their life. And I've always thought if we could get kids off to a good start on understanding how to take care of themselves, how to eat the right foods, how to understand some basic principles about your cholesterol and all those kind of things, that we'd be this is obvious, we'd be a lot healthier community. And getting kids off to that good start.
Yeah, absolutely agree. My daughter has just finished medical school, and so I've kind of experienced her training. And I still think that medical schools are focused on taking care of patients who already have a diagnosis.
Yeah.
And the healthcare industry doesn't put enough funding into preventative work.
I'd like to see us someday come together, and you and I'll talk off camera someday about this, but creating a wellness center for young people and talking about exercise, nutrition, some basic health principles, that sort of thing. So, but that's another time. Jay, this program's about leaders, community leaders. And how would you describe, you're a leader, how would you describe your leadership style?
So I would describe my leadership style as collaborative. I'm just happen to be at the front of a table of a team of smart people, both, and that's one of the things I love about working with physicians, is because you can be a leadership team and cultivate those really smart minds into being part of leadership.
Well, I think that's what good leaders do. That's why you're a good leader. Jay, I've enjoyed our conversation. We're already out of time. I missed about 15 of my questions, so we'll do this again sometime, but I really appreciate all you do for this community, the doctor's clinic. Being a healthy community is so important, and you guys are right up at the front of that battle. So thank you very much. And I want to thank everybody. We'll see you next time on a conversation with another community leader.
Leadership Kitsap is our community's civic leadership program. Leadership Kitsap fosters and empowers educated, prepared, and engaged community leaders. For over 25 years, we have cultivated leaders that work collaboratively to create positive change, dedicated to making our community a better place to work and live. We expose our class to Kitsap's leaders across public, private, and nonprofit sectors. We're happy to bring many of the conversations with these leaders to you. Strong leaders build strong communities.